So today's topic, as you probably know by now, is I will be talking on clinical symptoms of depression, and I don't think we talk enough about it, and I believe we need to talk a lot more about it. As a physician and practicing for like 20 years, I feel that it's still, it's like a very big taboo, like the way we can talk about hypertension or hypercholesterol or diabetes. We are not having a comfort zone in talking about mental issues. Mental issues actually affects about at least 10 to 12 million Americans. And of course, around the world, it's everywhere. And one of the mental issues I really wanted to talk to you guys about is clinical depression and how to kind of tackle clinical depression, how to feel better. I don't like this video to be in a scripted format, so I decided to talk to you guys just in person, and so that you guys can just hear what I feel about mental issues like depression or clinical depression. So having worked so many years, I get to see a lot of patients who are going through a lot of health adversities. If you thought that a doctor's day was tough, it's not just tough, it's very, 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 very tough. And you can ask any doctor, no matter what kind of doctor, the day goes by in like literally you're missing a beat here and there. So it's very important that as physicians also we can remain mentally we are there for our patients, because if the patient is talking to me and if I have symptoms of depression or I am not able to function at my best, then my patients are going to suffer because they will not be able to see a doctor who is mentally ready to listen to what this person has to offer. So every time we go in a patient's room, we are kind of talking to them about various medical issues. And a patient who has depression, they are not going to come in with the diagnosis that, doc, I'm depressed, give me some medication. They're going to come in for neck pain. They're going to come for headaches. They're going to come for dizziness. They're going to come for nausea. It's not going to be a straightforward discussion that we will even be able to go into depression, because even the person who is talking about it is not sure exactly what that person has, because this person has never been having these feelings in the past, and that person had to probably fight for a year to even talk to us about it. So that's why I kind of wanted to bring up this issue, because I think it's still quite a bit of mental issues are a taboo to discuss. I don't know why exactly, but the way we freely discuss about high blood pressure, what are you doing for your blood pressure management? I'm a beta blocker, I'm on this one, I'm an ACE inhibitor. Patients talk amongst themselves, but in this case, I don't think we discuss or even bring up this topic. It is very, very important to distinguish between depressive symptoms and actual clinical depression. Because a lot of people, I could wake up in the morning and say that, oh my God, what a cloudy day, I'm very, very depressed. That's not depression. You have to have the symptoms for at least 2 weeks continuously. If you're having morning you're getting up from sleep and you're feeling bad, and in the evening you're feeling fine, you do not have depression. That is not clinical depression. So that's very important. However, I still feel that there is a zone in which a person could still be depressed and not feeling depressed like every day. So it's very important that you at least bring up this topic to your healthcare provider, that I don't know if this is something relevant, or should I talk to you about, or should I see a counselor? At least bring up this topic so that we can at least freely talk about anything that we have to offer for you. Depression, clinical depression is basically it's a mood disorder in which you have a persistent feeling of sadness, and this feeling of sadness is not going away. This feeling of sadness leaves you not just with a pain in the heart, but it leaves you with a feeling of emptiness around you. You feel like that as if you are going through an immense emotional and physical turmoil. Some people will have headaches, some people will have racing of the heart, they could have panic attacks, they could end up in the hospital. For moms and dads out there, it's very, very important. I have a 12-year-old. I completely understand, like how difficult it is in the social media age to kind of keep children protected. But for all of you who are listening to this, I think this is so very important that we definitely address issues. And if they are willing to talk about it, please listen to your children, because they might have to say something. If you do not feel comfortable, take the person to a counselor. If the person is going through a grief, maybe a death in the family, they need to see a grief counselor. If they are going through days where the person is not feeling good, melancholia and all of that, you need to take that person to a psychologist and see what's going on. Even if they're getting bad grades in school, and for people who are watching who are adults, both men and women, we are not talking enough about it. So you guys need to come forward. As physicians, we need to also embrace you when you are telling about this. We need to keep our pen down, keep the computer closed, and start eye-to-eye contact with the person as to what is going on here. This is not the time to be reading the whole chart of the patient. Neither it's time to kind of let's write down what symptoms of depression you have. No, this is the time when you are going to put down your pen, you're going to put down your computer, and you are going to turn towards the patient. Your body language is going to be embracing. The same thing, it runs like it doesn't matter who is listening to that person, but someone who is listening needs to listen with embraced arms as to what this person has to say. It is not necessary that all symptoms of depression or clinical depression will need medications. You might be fine without medication. Just psychotherapy or some counseling sessions may be enough for you. And some people can have to go to medication when counseling or other therapies are not working. I'm going to give you a small example. I saw a patient, I think the patient was around 18 years old, and she came to me. She was brought in by a family member. She was having this long course of headache which nobody is able to diagnose. They have tried, migraine medication, stress headache. A young person, she is in college or school. I just don't exactly remember, but some sort of like a non-stressful life, and she's having these headaches and nothing has been working. And after a couple of visits, I was like, there is nothing going on here. I think we need to talk to the patient. So that day actually was a day when I said, I'm just going to go into the room, not open my computer, not take my pen in, and just talk to the patient. And I started talking to this young person, and I realized that all this while when I was putting more attention to my documentation and my chart, which is of course very, very important, but my attention was diverted from the patient, possibly because you're looking at a lot of things, the screen, and all of this can affect the way you are looking at the person. And when I looked at her, I could see that she was asking for help. And when she was talking about her symptoms, I realized that she usually smiles a lot. And when I saw her, she was a very, very smiley girl. She was not melancholic. She was not like looking depressed. There is nothing of that sort of symptoms that the patient was having. Whereas the patient was actually smiling the entire other 2 visits and talking to me and just telling about this headache, which I feel some people can repress their thoughts of depression by smiling or doing things which will make them feel less depressed. As a community, as a profession, as a professional person, as a physician, and being part of a community has helped me in probably tackling depression much more better than I have learned from any school or class in depression. My 20 years of experience has helped me in knowing from you guys, from people who have real depression. I will be lying if I just said everything was great. I had never had a depression or a dull moment. That is not possible. I'm a very, very, very assertive and positive person. In spite of that, I have days when I have struggled getting up from bed. I'm overwhelmed. I cannot function like the first 2 hours in the morning, and then I was like, what is going on? I need to get up. I have so much things to do. I have to shoot this video. I have to, get the cooking done. I have to do the charts, and I just kind of feel better. And for a few months, I have not been able to exercise. As all of you might have known, that I suffered an injury when I went to a ski resort this vacation during the Christmas and New Year's, and due to that I have not been exercising because my hand surgeon had told me not to use my right hand and for exercising at this time, and usually I do an hour yoga. So I felt that this last 6 weeks has been even a journey for me, a person who is so positive and assertive, who exercises like every morning. I wake up in the morning at 4:30 in the morning and exercise till the other people in the house are awake, because I know once they're awake I won't have that time to myself. And this hour was so very important. I felt, oh my God, I'll be able to sleep for 1 hour more. But actually, you know what? Exercise just made me feel so good that there was never a day when I was like, no, there is nothing wrong. Everything is like great. Everything was absolutely fine. And it's just a state of your mind. Happiness is a state of the mind. Similarly, depression, clinical depression, is a disease in which our neuroreceptors in the brain are not functioning the way they should be. We have a deficiency of SSRI or serotonin reuptake inhibitors, SNRIs, which are used for the treatment. So we have a problem with the serotonergic or adrenergic receptors in the brain. Due to shortage of that, in layman terms, we do not have enough neurotransmitters in the brain to function the way. And that is why we go through this symptom. And the SSRIs or medications to treat depression, what they do is they increase the receptor level of the SSRI or the SNRI receptors in the brain, the serotonergic receptors in the brain, and you suddenly start feeling better. There is no harm in taking a medication for 2 or 3 months. If your doctor suggests it, if you feel that no, you are losing days here, you are having neck pain every day, you're having bloating, you're having nausea as symptoms, it's okay. You can try the medication for 3 months. You do not have to be on the medication for lifelong. You could call your counselor, or you can just talk to your friend or anybody you can confide on, your physician. Like I have been able to connect with people. I thank God for that, because if I was not able to connect people, I don't think I would have been able to do whatever I can right now do for my patients. And I feel that it's very, very important that you can connect to anybody whom you're talking to. Please, please, please talk to your people, talk to your folks, talk to your friends, talk to your doctor about the feeling of depression, that you're not feeling good. It's not going to be just that you're sad and this life is not worth living it. You are going through a lot of problems. You had a breakup in a relationship. You had a divorce. You had a difficult marriage going on. You had so many things. In spite of all of this, you still could get yourself out of this if you think that this is a state of the mind. I hope you liked whatever I tried to express today. This was absolutely meant for people who feel that they might need a little bit of help with getting through depression. And this will probably be my first video in this series, and I will continue doing a few videos in this series. Please do not forget to subscribe to my channel, Doc Nature Lover, and please follow me on Instagram at NatureLover. Keep smiling. I'm going to put all the information down below, and you can also find me on Facebook at Doc Nature Lover. So I hope you guys have a very, very blessed day, evening, or morning at whatever time you guys are listening to me. Thank you so much for being there.